All righty, I think we are here. Um, Welcome everyone. I'm Dr. Michael Wong. This is Dr. Teresa Pancotto. She is a neurologist at VSH San Diego. Is that, well, I guess tell us a little bit about yourself.
Yeah, so I just started here at VSH in April, so I'm relatively new to the California area, but I worked at Virginia Tech for about 12 years, did my residency there, and then stayed on as faculty member. I'm originally from the East Coast, so now I'm a West Coast transplant, and it's brand new and a little bit different given the COVID situation, but it's grown on me.
How is, how are you guys affected by COVID?
We've stayed very busy. A lot of the smaller hospitals in the area closed, which meant a lot of the ER traffic increased here. So we've stayed plenty busy. Everything is curbside and by the phone, which has its downsides for sure. But I think everybody is being patient with the process and understands why it has to be that way.
Yeah, that's quite similar here. We haven't had quite as many closures. We've had a couple veterinary hospitals closed temporarily just for a couple weeks, but everyone seems to be, be busy right now. So we're relatively fortunate compared to many other industries. So for those of you that don't know, I mean, this is actually kind of my first time talking with Dr. Pancotto. So I'm excited in that, in the past, we've always had a Southeast veterinary neurologist on with us. And many times, probably 95% overlap in how we treat things. So there's usually kind of the same answer that I give is the same one that Dr. Fitz would give, or, Dr. DePompa, et cetera. So I'm actually really, really excited to see the similarities and differences in how we approach things. So if you haven't already, please start sharing this just to anyone that you think might be interested in this. Anyone that has a question or has a pet with a neurological problem. Also, veterinarians, please submit your questions. You can put them in the comments and we'll try and get to them. We've got a good set of questions already today, so but please put your questions in the comments. Last thing, the 7 Synapse conference, we're doing it virtually this year. It's October 4th. It's for veterinarians. I believe it's 6, maybe 7 CE credits. If you're interested and want to learn more, please send an email to q&a@sevneurology.com, and veterinarians will have a chance to get a free registration for it. So without further ado, I'm going to bring in Brian here.
Can you hear me?
We can, perfect. How are you?
Good, how are you?
I'm great. This is Dr. Pancotto. I'm Michael Wong.
Hey.
Where are you calling from, and what's your question? What's going on with your dog?
I am from Baltimore, Maryland. My dog is 14-year-old Border Collie. She has multiple health issues, chronic liver disease, environmental allergies. She was diagnosed in December with hemangiosarcoma. And the week before last, she started with vestibular disease. Now, this is the 4th pet that I have had that has come down with vestibular. So I'm trying to find out, is there something that I'm doing wrong? Am I not feeding correctly? Is it medication? Why have I had 4 pets with this disease?
That's a great question. And I would just say to start out with, congratulations for getting to 14. I feel like that's always accomplishment in this day and age because, we see so many more diseases and that type of thing, but that's great. You're obviously taking really good care of her. With respect to vestibular signs, we lump it into that category of vestibular disease. And the first question as neurologists that we always ask is, are the symptoms reflective of a central disorder, so something in the brainstem or cerebellum, or a peripheral disorder where it's in the part of the vestibular system that's actually housed in the inner ear? So those are the 2 main components. And obviously things that are going to affect the brain and cause vestibular signs are going to be more sinister than something that's in the ear that causes vestibular signs. So if we look at this peripheral side of things, in old dogs in particular, it's not uncommon that they get what we call idiopathic or geriatric vestibular signs. I don't know if that's what your dog has, but it certainly sounds like it could be given the older age. And so that's something when we say idiopathic, it means it happens for reasons we don't entirely understand. So that's something that's out of your control, probably has nothing to do with diet, et cetera, et cetera. As far as the central problems go, you know, things that we see more commonly in older dogs, particularly in older dogs that have multiple other underlying diseases, we worry about things like vascular accidents and hypothyroidism. So if it's a more central problem, those are the two of the things that I would think about potentially being higher on the list. There are lots of things on the list, but those would be the two that kind of come to mind as the most common. So that's question number one. So it's hard to answer as far as like, did all 4 of your dogs have the same thing, or have they all actually had 4 different underlying etiologies? I think regardless of all the things that we know that cause vestibular signs, really none of them can be attributed to anything that you do or don't do. It sounds like you take really good care of your pet, so, you know, I don't think the likelihood of there being a huge dietary insufficiency, we see that sometimes, probably more so in cats, where if they have B12 deficiencies, they can have vestibular signs from that. If they're on a good diet, it's really unlikely to be the case. So I feel like that was kind of a roundabout answer to your question. I'm not sure if I answered all parts of it or not.
She's eating the Hill's prescription WD due to her liver.
Yeah, so the Hill's diets, I mean, any of the Hill's diets, Royal Canin diets, the ones that are done veterinary prescription, you know, they have veterinary nutritionists on the board that are designing those diets. They've been through food trials. They're certified by AFCO, so they're really, really good diets. So the odds of you running into an issue because of the diet in that case, I would say would be extremely unlikely to blame it on the diet.
And I had given her her Frontline Plus. It was on a Thursday, and the following day she started with these vestibular symptoms. Could that be contributed?
I doubt it. I always find the question of preventatives and using preventatives in dogs that have neurologic dysfunction to be an interesting one, because most of them are neurotoxins to the parasites that they're treating. And so in theory, it makes sense that any dog could have an adverse reaction to one of those. And if you ask the companies, there's usually some note about that deep in the paperwork. That being said, the new products have been demonstrated to be highly safe and effective in most dogs and cats. So there's no strong evidence that would link those two things together.
I assume that she's now susceptible to having another episode in the future.
It depends on the cause. So if we think that she might have had a stroke or a vascular accident that led to the vestibular signs, she's got some underlying diseases, so it's definitely possible that she could have another one in the future.
The fact that she was given Orvax and prednisone and she recovered pretty well, she still has some balance issues. Due to the fact that she's recovered a little bit with those medications, could you say that this is idiopathic?
Not for sure. So idiopathic gets better on its own. Using Orvax and prednisone is going to cover treatment for a number of different treatable conditions, whether it's an inflammatory process, an ear infection, inflammation in the brainstem. That's going to cover a broad spectrum of things. So just the fact that she got better with treatment is awesome, but it doesn't necessarily help narrow down the cause. Now, if, you know, a month down the road, you repeat her neurologic exam and there's absolutely no evidence of any vestibular dysfunction at all, then I would think that an idiopathic condition would be most likely.
Okay, so with the preventatives, you're saying that it's safe to continue the Frontline and safe to continue HeartGuard that she's also on.
Mm-hmm. And especially if you're in an area where, and you're on the East Coast, heartworm is a problem there. So I would say prevention is going to be worth its weight. So I definitely think continuing those things is worthwhile.
Are you able to answer any questions in regards to her liver issues?
You probably don't want me answering those.
Okay.
Not being an internist, yeah.
Okay.
Me
All right.
either.
I'm sorry.
Me either.
Okay. All right. I think that you've covered the question that I needed to ask. I thank you for your time.
Yeah, you're very welcome.
Thanks. Best of luck.
Thank you.
Yeah. So, oh, there you are. Yeah. Interesting. We answer things pretty much the exact same way. Of the whole, central versus peripheral, and we really don't know the cause, so it's tough to answer those questions. And that's the sort of stuff that oftentimes we run into on these, where we don't have the luxury of looking over blood work or examining the dog. That it's you can only answer so much. But great, we've got like 10 minutes before the next person. Should we start at the bottom, Emily? So these are. Is there a chance? So I guess this is a very similar question to what you just answered, but I guess instead of in the vein of talking about vestibular disease, I tend to get the question more around seizures. So Kathy asked, any flea and tick treatments that are safer for dogs who have occasional seizures?
Right. So very similar answer to what I said before. Like, you go read all of the details. There's always maybe some theoretical risk because of the mechanism of action of those drugs. A lot of the newer ones, and I think it's the Lehner class, all the drugs that end with LA and ER tend to be a little bit better for the dogs with seizures. Some of it is trial and error too. Like, I definitely have patients where it seems like their seizures are like clockwork when they get their monthly medication. And if that's the case, then we switch it up because it could be coincidence, it could be drug related. But if it seems like it's a predictable problem for that individual, we'll change something. But I would not make a blanket statement that they're bad for dogs with seizures. And again, I think prevention is far more important, particularly in certain areas for flea and ticks and heartworm and those types of things.
And I don't want to put you on the spot there. Are there any ones that you prefer over others, or any?
Well, I used to say the Bravecto collars seem to be kind of the most ideal as far as less systemic consequences. And then I had one patient in Virginia who developed vestibular dysfunction, and we went down the whole road of MRI and CSF. And the only thing the client ended up changing was taking the collar off, and everything resolved.
Thanks.
Might be hearsay, but that one made me a little bit suspicious. But previously I would have said Bravecto collars.
Okay. Great. So we've got someone that wrote from Hong Kong. So that's officially our furthest. We've had some people call from London, but now Hong Kong is our official furthest question. He has a 4-year-old French bulldog named Oreo. Our boy has come home yesterday and is 7 days post-op. In the vet, he had diarrhea, but since he has returned home, there's been no bowel movement. He is peeing, eating, and drinking normally, just no poo yet. It's been nearly 36 hours. He is currently taking omeprazole with his pain meds, gabapentin and buprenorphine. Is this normal? And if not, what should we do? We are planning on calling our vet in the morning if he still hasn't passed any stool. And then second question is, what is the expected rehabilitation process / progress for a grade 4 IVDD case at T11-12 with realistic timelines?
Okay. So I'll start with the first one about the GI disruption post-op. A lot of times in our spinal surgery patients in particular, it can take up to a week after surgery before they start to have normal bowel movements. In your particular case, because there was the onset of diarrhea, that's going to change the whole GI motility and throw things off even more. So the fact that it's been 36 hours, I wouldn't be too excited. I'd probably give it a couple of more days, maybe closer to 72 hours before I thought about being really worried about it. A lot of people will rush to give enemas to those patients. which yes, it will pass stool, but then you might just be slowing down things further because you've just emptied the colon and it's going to take more time for fecal material to build back up again. I kind of live by the rule, the poop will always come. So you give it time and it's going to happen. The second part of the question, for recovery times of grade 4 IVDD. If you look to the literature, the average recovery time historically has been 13.6 days, 2 weeks. I like to keep things simple. So I usually say 2 weeks for them to go from not being able to walk to being able to walk on their own. Still potentially a little bit wobbly at that point, but fully ambulatory without assistance within 2 weeks. There's some newer data, which in the papers that looked at physical therapy, they didn't necessarily pull this out, but if you compare it to the older literature, patients that have physical therapy are often walking in about half the time compared to those that don't have any type of physical therapy. So that's lumping the ones that stay in the hospital for PT into the group that goes home and they just have kind of basic exercises to do at home. Those animals do seem to recover in about half the time. It was 7 or 8 days compared to the typical 2 weeks. So it sounds like you're on track for a pretty normal recovery at this point.
So what do you guys do at VSH with regards to rehab? Do all post-op patients get rehab while they're in the hospital, and is it?
Yeah, I'm only keeping them for about 24 hours right now, so it's a pretty short amount of time as far as being able to start a rehab program. When I kept them longer, then almost everybody would get started on their package on day 2 post-op. But here I have a tendency to send them and get them out of the hospital a little bit more quickly, largely because of cost. It's way more expensive to keep them here than at Virginia Tech. So I try to kind of minimize cost, maximize time in the hospital and see how they do in 2 weeks. And if they're not following that 2-week recovery period, then I look at getting them involved with rehabilitation. Or if they're patients that I'm worried about maybe having a slower recovery because they were down for a longer period of time or more severely affected or had chronic changes, those guys I will send home with exercises to do at home.
Yeah, I'm kind of the same mindset with the whole pooping thing. Just for a typical T3L3 dog, you know, if they're not pooping, it will come. It's just a matter of time. So, you know, the number of times I've had to give an enema is 0. The number of times, you know, in my residency, we kind of had a part of our discharge template was, you know, giving a stool softener if there hasn't been something in a certain amount of time. But the number of times that I had to do it in my residency or that I've ever had to do it is all of 0. So it happens.
The other thing that can be helpful is stimulating them with like a Q-tip or a cotton tip applicator. We primarily did that for cases that were getting in the underwater treadmill, obviously to make sure they poop before they go in the pool, because nobody likes to deal with pooping in the pool. And sometimes that's something that clients can do at home. That's pretty easy.
It looks like Bart's owner is here. So I will let Bart's owner in. Can you hear us all right?
Yes, I can.
All right. We've got you sideways. I don't know if just turning the... Perfect.
There we go. I can do this.
We were all going to have a slight head tilt if that was going to be the case. So
yeah, not a problem. No, I'm on my cell phone, so I'm pretty mobile here. Thanks for having me on. Calling from Edmonds, Washington, and asking about questions about Bart. In fact, he had a seizure yesterday morning again. He's had. We had a 2-month and 20-day free spot there. He had a seizure in May, and then he had 2 seizures beginning of August, one on a Monday and then the following Wednesday, and then he had another one again yesterday.
So Bart's a 7-year-old greyhound, and you've had him for about 4 years.
Correct.
He started having seizures when? Last year?
It was a year ago, last April.
Okay. And since then, he's had frequent seizures, it sounds like. How often?
He's had, I did some research yesterday. He's had 18 seizures in the last 16 months.
Okay.
So, and it's like, it seems very, very random. He'll go a month seizure free, and then he'll have a seizure and another seizure in a week. And then he might go 2 months free, and then he'll have another seizure. He's only had, there was one day he had 2 seizures in one day, early in the morning and then later in that evening, about 11 hours apart. And then the next closest pair of seizures was August 3rd and August 5th. So, and then yesterday. So that was what, another 13, almost 2 weeks.
So from what we've done so far, you've gone to see a veterinary neurologist. They've done some blood tests.
Yep.
We haven't done an MRI or a spinal tap.
No.
Is Bart normal between the seizures?
He seems to be normal. We've got him on about 1,250 milligrams of levetiracetam ER, and that's every 12 hours. So that seems to like keep him kind of subdued a bit. So he's not a lively guy. He's an ex-racing greyhound, so he's pretty serious. It doesn't play much or anything. In fact, he's sleeping right now, which is pretty common.
There he is. So what's your question for Bart?
Well, the questions are, and I have a few.
Yeah.
We follow sort of a protocol when he does have a seizure, and we, like, during the seizure, if we can, we'll put ice on his back. We will try to place a hand over his eyes and apply sort of a light pressure, ocular pressure. As soon as the seizure seems to stop, we will give him a few tablespoons of some vanilla ice cream, told that it helps bring up some blood sugar. Just wondering if any of these things are things that you've also heard of, and if they are actually, if we're helping.
So for that part of the question, the ice, there is actually data in people that shows that cooler temperatures can stop a seizure, prevent seizures, et cetera. So I definitely think there is evidence behind using ice during the seizure. When I've had people do it, it's part of what I call my seizure voodoo. And I call it seizure voodoo because, at least in veterinary medicine, I don't have good data to say that it works, but I can be pretty confident that these things that I include in that category aren't going to hurt. So they're worth trying for some people, and some people don't have any interest in trying. They may work, but then they're definitely not going to be harmful. So that's one of the things that I do talk to people about, but I usually recommend using it close to the head. So where the seizure activity is actually originating.
We do it right at the base of the neck is where we've been doing it.
Yeah, so seizures are going to originate from the cortex, which is going to be kind of more on top of his head. So that's probably the area that I would aim for.
Okay.
As far as the vanilla ice cream, again, you have another cold ingestion thing. I don't know that the sugar component of it, unless it's a really long seizure, would be all that beneficial. It takes minutes, if not 10 to 20 minutes or longer, for the blood sugar to really significantly drop with a seizure to the point that it would be concerning. So if it's a short seizure, the sugar from that, I don't know if that will be helpful. Again, the cold component, if we go back to that whole theory about cooling, maybe there is some utility in there. The only other caution I guess I would have with ice cream is some dogs don't tolerate dairy very well and can result in diarrhea. So particularly if it's a larger volume, that might be something to watch for.
Right. We haven't had that problem with the ice cream. He seems to like it. He comes out of his seizures. We didn't realize this at first, but he's blind when he comes out. His seizures generally last about 1 minute. It's all very violent, everything is just going crazy for 1 minute or so. And then he just starts to come out of it, starts to breathe again. Like yesterday morning, we noticed that like maybe his skin was starting to turn a little blue on his chest. A lack of oxygen, whatever, I'm not sure, but about 1 minute seizures is pretty consistent for him. But the ocular pressure, does that?
Yeah, so I've not used a vagal maneuver for isolated seizure. There are some studies in veterinary medicine that actually look at vagal nerve stimulators. So they're devices that are stimulating the vagal nerve repeatedly over the course of the day. And those have been shown in people and animals to actually raise the seizure threshold or lower the number of seizures that a particular patient has. To my knowledge, and it's been a while since I've looked at those papers, it does work better when it's done over the course of a day as opposed to just a single event. And Dr. Wong, you could chime in on that too, but it's been a while since I've looked at the vagal nerve literature.
I haven't looked at that in quite some time.
Okay. Well, we're trying to do it during the seizure. I mean, we're trying to actually just very gently put our palm over his eyes and just apply as light a pressure as we can. Yeah, and does it help? We're not sure. I mean, the seizure goes about a minute, pretty much no matter what we do. So far, it seems like maybe the ice a little closer to the top of the head might be more beneficial.
It's certainly worth trying. You're not going to make anything worse by doing that.
Okay. We do add MCT oil, and just recently started the CBD, but we've been adding MCT oil, about a tablespoon. He's a 75-pound dog. We put about not a tablespoon, a teaspoon per meal. Don't want to get too much fat in his diet for pancreas and that sort of thing. Is that something that's been studied? Is that helpful at all?
MCTs have been studied a little bit. So there's a diet that came out from Purina called Purina NeuroCare. That's a higher percentage of MCTs, with the idea behind it being to create more of a state of ketosis in dogs, which is hard to do anyways because they are more carnivorous than people are. And so it's much harder to actually achieve ketosis. And for some dogs in that study, it did work. They were just shy of meeting statistical significance in the paper. So future studies are needed to say with certainty if it's beneficial, but I think it does work for some dogs. In general, MCTs are great for the brain. So even if it's not necessarily doing anything to affect the seizure frequency or severity, I think it's still a good, healthy, supportive brain thing, especially as Bart ages. It's a good thing just to promote general brain function.
Yeah. He turned 7 last May, so he's a little over 7 years old. We just recently started adding CBD oil to his meals every day. And once we started with the CBD, we actually got our very longest seizure-free period. He made it 2 months and 20 days. And then right after that, then he had 2 seizures 2 days apart. So it's all just seems very, very random.
And that's the nature of seizures, is they wax and wane. And I think that's the most frustrating part about probably being an owner of a pet that has seizures, is sometimes, especially if their seizures are relatively infrequent, because the nature of epilepsy is to wax and wane, it can be really hard to know if what you're doing is working or is it just coincidence, like you happen to be in a low phase of the seizures versus a high phase. So it does make it frustrating. With CBD, California laws restrict me from particular advice on using it. So the only thing I can comment on is that it is actively being studied in veterinary medicine. There are a number of different institutions looking at it for seizure control as well as some other conditions. And there's a paper that came out of Colorado within the last year, or maybe it was about a year ago, that again was one of these things that for some dogs showed benefit but didn't end up reaching statistical significance for the entire population of dogs. There's some issues with that paper, like the dosing was maybe not what it should be for the particular product that they were using. So I think the bottom line is with CBD, we still just don't know.
And that's what our neurologist told us too. At first, didn't even recommend it because said there just weren't enough studies and there wasn't enough known about it. Just recently said, well, she's seen some things that might have some positive effect, and it probably wouldn't hurt to try. So I mean, we don't put a lot in his food. He's got like a, the bottle says 500 milligrams, which I'm assuming is the whole bottle. We give him about 10, 12 drops per meal. And we try to keep that up 2 hours away from his levetiracetam, because I've heard that maybe there was some sort of there could be a problem with giving them too close together. Again, probably not enough studies or information to come up with anything specific on that. But and let's see, what else did I have? Oh, exercise. If he's had a seizure like at 6 o'clock in the morning, and then he seems to recover, and we usually have to throw him in the shower. He, empties his bladder. Rarely we get some feces, but almost every time he empties his bladder. So we give him a shower, and then he seems to, he's post-ictal for an hour or so. After that, he seems to just be BART again. So exercise, going for a walk, something like that, is that recommended?
Yeah, I think there's no reason not to take him on a walk, unless he's a dog that gets stressed out by things on the walk. So if if he hates garbage trucks and kids on bicycles and things like that, and you're walking at a time of day where all that is happening, maybe that kind of stress isn't the best for a patient with seizures. But if he enjoys going on those walks and being out, then there's no reason not to have him do that. Right. And then back to the heat theory, again, if we think that ice makes a difference, probably best not to walk him at the hottest times of day, or at least just have
right.
that limited.
No, we don't. Yeah. If it's 70, if it's much over 70 degrees, we just don't take him out and walk him, because I don't think that he handles the heat very well. And that was another problem up here, and we're in Edmonds, Washington, just north of Seattle. Just the other day, we had a 101.8 in the backyard, was measuring in the shade. I'm just wondering if that really, really super hot weather might have triggered something. This was just a couple days ago that we had that. So hot weather. We didn't take him out for a walk that day, obviously, but he had a seizure a day or two after. But I don't know, weather, is that really hot weather? Could that trigger?
I mean, it's not something they've looked at statistically. I think they've looked at lunar cycles and have seen changes in seizure control with the moon, of all things.
Full
which
moon? No,
I've
done a lot of reading. I've heard that before.
Yeah.
So, and that doesn't seem to, we've looked at his seizures and gone back and looked at different moon cycles and things, and those didn't match up. So I don't know. He's an ex-racing greyhound, and he came from Florida, probably Dr. Wong's neighborhood. He has had persistent hookworms. They told us that they were possibly encysted. We'd tried several different medications to rid the hookworms. We'd get a clear fecal sample, and then the next time we'd take him in for a fecal, they'd be there again. The last medication we used was Caraxa, I believe, which is a topical. His last fecal was clear. Now he's going in for another vet visit here in another week or so. Kind of wondering, he's going to get a rabies vaccination. We've given him all of his vaccinations so far. We split them up, not given them all at the same time. He's got one vaccination left on his next appointment, which will be a rabies vaccination. We will do a fecal on him at that point in time and see if we're still clear, hoping that we are. Would the hookworms have anything to do with seizures?
No, it really shouldn't. If you go on to Google and even some other places, you'll find these allusions to different parasites causing seizures. But if you actually try to trace that back to like any specific study that identified a parasite or multiple parasites as cause of seizures, there's actually no study that comes from. So where those little bits and pieces on the internet originated from, I have no idea. It might just be lore. But I'd say that's not likely contributing.
Okay. Well, that And I guess one last thing, rosemary extract. It's like in everything. And I've heard, you hear things that rosemary can be a trigger. Now, we don't give him ground up rosemary herbs, but there's rosemary extract in foods and pill pockets and just about everything you come across. Is that cause a problem for you?
That one I don't know. The rosemary oil, I don't know. There are toxic essential oils, like pennyroyal oil is really toxic to dogs. That one you have to be particularly careful of because it shows up in a lot of natural like flea treatments, but it can be really bad for dogs. But I don't know about rosemary.
Yeah, our neurologist said she didn't have any problem with the extract that's in food. They use it for, I guess it's sort of a natural preservative. But I think that pretty much covers the questions that I had. Thank you very much for having me, allowing me to participate here today. So that's probably about all I have.
Mm-hmm. Well, good luck with Bart.
Thank you.
Okay, thank you very much.
Take care.
Okay, you too.
We're putting you through it today. You've got some getting all the tough ones. Thank you for answering. And
Yeah, I think seizures are a little bit tough to talk about because honestly, there's no one right thing to do. Part of the reason I think they're fun to treat is because there's lots of different, it's like a recipe book almost, and you can just play with that recipe. They're also very frustrating because again, the nature of the disease is to wax and wane. But it's hard to not do it right.
right. Yeah, I mean, again, I just think these are the tough questions in that, you want to be able to give an answer, but you're trying not to just say, well, there's really no study that, supports it. And that's where I tend to go of, hey, I can't recommend it because I don't have anything supporting it. But I mean, all of John's questions, we're kind of right around that with the whole, the CBD and the ice cream. It's easy to sort of dismiss those things, and the reality is I don't think anybody knows, but I think it would be tough to put together a study on giving ice cream and seeing what happens. So
yeah, like I said, I've actually read the ice stuff in people because the first time somebody told me about it, I was like, I don't know what you're doing. That's crazy. And then I actually looked it up, and there is data in people about using it. It's been a while since I've actually looked at it, and I didn't read it that critically. I was just looking at kind of what was out there. But there's a bunch in people that like we're nowhere near knowing if it works, could it work, could we study this in dogs? Like there's a recent study that came out where they used Mozart sonata for 2 pianos or something. And so they randomized it. So epileptics heard it like as written, and then they heard it in a scrambled version. And when they were listening daily as written, they actually had a reduction in seizure frequency compared to when they listened to it scrambled. So that's another one that I throw into my, well, it's not going to hurt. Turn some Mozart on for your dog.
all right. I don't foresee that becoming part of my repertoire, but it certainly goes in the isn't going to hurt anything. But so it looks like I can't read that. Havelock. He's in Canada, 6-month-old border collie. Nearest neurologist is 2 days drive away. Our 6-month-old collie has been having violent seizures since May. Diagnosed with epilepsy, started on phenobarbital. It's been 2 weeks now, and he's had 1 seizure in that time without easy access to a specialist. How can we work with our vet to ensure the best possible treatment? What topics do we need to cover off beyond the basics? We'll bring Malcolm in. Perfect. How are you?
Dr. Wong?
Yep, I'm Michael Wong, and Dr. Teresa Pancotto is here as well.
Nice to meet you both.
You too.
Likewise. So I've got your question here, but if you just want to, so Havelock, 6-month-old border collie, seizures starting in May, on phenobarbital, and what are your questions?
basically, my concern is without easy access to a canine neurologist, how does one manage care for an epileptic dog with, for lack of a better word, a conventional veterinarian?
So a lot of veterinarians do a really good job managing seizures. And so that's number one, because it's an extremely common disorder. So they're going to see a lot of it. So that already gives them some credence there. But then they also will have free access to veterinariologists through the telephone. So most consultations are free. So if they get into a situation where, you know, maybe your pet ends up on 4 or 5 seizure meds and they're getting a little bit nervous about how to titrate those drugs. Should we try to reduce the number of drugs? What's the timing of them? Do I go to 3 times a day phenobarbital versus twice a day phenobarbital? That's when a phone call can be really helpful.
Okay, I understand that. The concern we have is based on our vets' sort of initial reluctance to consider a diagnosis of epilepsy. It was basically presented as a case of night terrors that the puppy would grow out of. And fortunately, someone involved in some animal rescue here suggested we seek counsel for a consultation vet. After a 90-minute workup, it was that veterinarian that determined that it was indeed a seizure, not a night terror, and suggested that we go the phenobarbital route. So I don't have 100% confidence that our vet would be quick to or knowledgeable about mixing one drug with another drug, and it's just a question of do I need to seek a second opinion, or should we just take the next consultation and bring my concerns to the fore and see if we can have a dialogue about that?
I think that's a good idea. I mean, as for any doctor patient, whether it's a human doctor and a human patient or any veterinarian and a client, you know, finding somebody that you're comfortable with and trust is important regardless of what the condition is. And so if you really like your veterinarian, I definitely think it's worth bringing up those concerns and chatting about them and just letting them know where you stand and what your perspective is. And if you feel like you don't get anywhere, then maybe you're in a different story, because it sounds like you sought out one second opinion, and if you need to seek out another, you know how to do that. And I always think being a client that can advocate and educate yourself is really important. So the people that go and read about things and ask questions about those. I mean, nobody loves Dr. Google, but you still learn, and you learn how to ask good questions when you go look for answers. And so even if you're asking about things that maybe there isn't any evidence for or against, having that conversation tells the veterinarian a lot about the fact that you want to know and understand what's going on, that you're interested in learning things, that you're asking good questions. And so I think that's important too. But I would say it's a conversation definitely worth having with your veterinarian. And then depending on if you're satisfied with the outcome or not, maybe you do need a second opinion.
Doctor, speaking of asking the right questions, we have our first follow-up appointment on Friday, the day after tomorrow. And during that time, there'll be a blood drawn, so we can check his progress with the phenobarbital. But what questions would you want me to ask at sort of 2 weeks into the treatment program?
That is a hard question for me to answer, because I'm always on the other side of that.
Mm-hmm.
I do want to say, first of all, yay for going to do phenobarbital levels. Of the reasons that dogs have refractory or uncontrollable seizures, the most common reason is that they don't monitor drug levels. So good for you for staying on top of that, because particularly with phenobarbital, just with the way it induces its own metabolism, that one we do have to do drug levels on a bit more often. So that's great that you're getting that done and staying on top of it, particularly in a border collie. And those dogs are known to have a little bit more severe seizures just by the nature of the breed. As far as questions to ask your veterinarian, you know, I think being open about your concerns with regards to night terrors versus seizures would be a good conversation to have. As far as the actual seizure control goes, you can certainly ask what their comfort level in handling a dog on one versus multiple drugs is, and if they have a relationship with a neurologist, so that you know they have somebody in their back pocket that they'll dial if things don't go according to plan or don't read the textbook.
Very good.
That's a great question. You put me on the spot. I feel like it's not a very good answer for that.
I mean, I think it's a great answer. I mean, I sort of take it of the way of, well, what am I trying to, when someone comes to me, what am I trying to sort of preemptively answer for them, or what are common questions? I guess things that I try and cover that are probably, worth asking your vet to, what sort of monitoring needs to be done. So we kind of already touched on the phenobarbital levels, but when do you want to see me back? How often am I going to be coming in? Because seizure management isn't kind of a one-time thing that we prescribe it and then we're done with it. It's usually lifelong management. I'd be asking things like, well, when is it emergent? When is it an emergency? And when do you want me to call? When do you want me to come in? So I'd be asking those sorts of questions. How close are you to an emergency center? And if there's a preferred emergency center that your veterinarian works with. I guess, tell me a little bit more about, I guess one of my questions is, since we're only 6 months old, what sort of other testing has been done?
Well, nothing. There's relatively little available to us here in Halifax, Canada. So it was basically it was sort of an appointment that my wife took the dog to with Dr. Flores at a clinic. She's an American certified vet that is practicing here in Canada, and is the closest thing I think we have to an expert. So she tested his pliability and his suppleness, looked at his tongues and cheeks and eyes, watched and videotaped his movement, everything from the way he tilted his head to how much coordination he had. And, it was that in conjunction with the videos that we had shared that you also have, that she arrived at the conclusion that it was epilepsy and not night terror. So, we're 2 weeks into the phenobarbital now, and we're seeing all of the conventional side effects: extra thirst, extra hunger, lack of coordination. We're also seeing a little bit of extra aggression, as well as some difficulty settling. He's very restive and has a hard time getting to sleep at night. So, I mean, one of the things we're going to want to talk about on Friday's visit is that something that's simply going to pass by as his drug reaches a therapeutic level in him, or does he need something else to sort of counteract those effects? There's so many things we don't know, and we're a little bit lost as to where to turn. If it wasn't for this one particular Facebook group that I found your link on, we'd feel even less sure of where we are.
So did they run any baseline blood work?
His regular vet did a baseline blood test, yes.
Okay.
And he's also had a bile acid test.
Correct.
To rule out any kind of liver shunt. And both blood work and liver shunt tests came back as no extraordinary results, perfectly normal.
Yeah, for me, in a dog that is between 6 months and 6 years old, they have a normal neurologic exam, a normal complete blood profile and chemistry profile, and a seizure disorder and normal bile acid profile. I'm pretty comfortable with the diagnosis of epilepsy, idiopathic epilepsy, especially if it's the right breed, so a breed that we know is predisposed. I typically don't always recommend an MRI in those dogs, and that's something that I know is fairly different from other neurologists. And my theory or my philosophy is that I suspect that the MRI is going to be normal in those patients. And I don't get super excited about spending a lot of money on a test result that is normal, because it's not going to change what we do. Now, if I think we're more likely to find something, so something about the seizure presentation is abnormal, they're a little bit too young, a little bit too old, they're not completely normal, their behavior is a little bit off, their seizures aren't responding appropriately to therapy, those are all reasons that I might more strongly advocate for an MRI. But for most of them, if they fit the bill for epilepsy, I'd rather people save the money and dedicate it to treatment, because it can be a challenge, because seizures wax and wane over time. And it can be difficult to figure out if it's going to be one drug that works for a patient or a combination of drugs that works, and just figuring out what dose of what medications is the right for your pet takes time and money to be able to do that. So I tend to prefer to dedicate the funds towards management as opposed to an MRI. I don't know if that gives you any peace of mind about where you are.
It does.
But it sounds like they've done a good job ruling out, easy metabolic causes of seizures in a young dog.
The the only access we would have to a veterinary MRI is at the veterinary college, which is a 5-hour drive away, and currently they don't have access to their machine due to COVID restrictions. So it would be a long, stressful journey to get the dog there. I'm sure we'd have a seizure on the way there. And then, as you said, a process that may or may not result in any kind of finding. And then we have to get the dog home. So yes, it would be, approximately $2,500, 3 days and 2.5 seizures, I'm sure, to find out probably not much. So
I mean, some people, they need it for peace of mind, but
Right.
I also, if it's worth it for you for peace of mind, absolutely. But otherwise, I think the money is very well spent towards treatment.
So here's the $1,000,000 question. A 6-month-old dog. Currently, everything is great because of COVID. I have 2 teenage sons at home while my wife and I are at work, able to help the dog through and make sure he's having a good day. But in relatively short order, life's going to at least spin up to the fact where both of those kids are back in school, and the dog will be home alone and crated for much of the day. And the big concern we have is whether or not that will be acceptable, and what his quality of life looks like as a dog who is, prone to seizures, may or may not be controlled, but spending the better part of a day inside of a crate.
Yeah, from a seizure perspective, I don't know how much that may impact things. From the perspective of the fact that you have a border collie, which is a pretty energetic dog, and it's a young dog, finding a way for them to have a job and an activity to do is going to be important from a quality of life standpoint, for sure. So whether that's, spending dedicated time in the mornings and evenings, going on walks, or actually teaching them tricks, could be very worthwhile, even if they do end up, in the middle of the day, created for much of the day. With respect to seizures, what I always tell people is you do what you can. We all have to live our own lives as well, but we want to not neglect our pets. So, keeping that in mind, a 3-time-a-day medication probably isn't the way to go. So if we have the twice-a-day medications, those are going to be better choices than something that might be 3 times a day. So keeping that type of thing in mind. If you want to invest in cameras so you can keep an eye on your pet while you're away, not a terrible idea. Is it absolutely necessary? No, because again, we do what we can within our means. Things to look for when you get home, is there urine or feces in the kennel that you wouldn't expect to be there that may indicate a seizure occurred while you were gone? Does your pet seem disoriented when you get back home? That could be a postictal behavior, again, suspicious of a seizure that might have happened in your absence. Those will be things that you want to keep track of. So whatever you're using to track your seizures, I would use that to make those notes. And so even if you don't witness an actual seizure event, but you see some evidence that there could have been a seizure, I would continue to track those as well.
The pups never had a seizure without loss of bowel and bladder control, so it would be pretty apparent pretty quickly. The only other, I think, comfort I can offer is he's actually not a border collie. He's a smooth collie. Okay. So he doesn't have quite the same energy level or drive. I mean, he's still a working sheepdog, but he's not bananas like a border collie can be. So
that might help a little bit.
Yeah. Well, this has been great. Has it been any useful for you?
I mean, I like talking to people about seizures. So yeah, and you asked some good questions. I liked your question about what do I ask at the 2-week mark. That was just a good way to frame things for me. So thanks.
Okay. So I think the one of the most important questions that I have to ask my vet is do they have a relationship with a neurologist, and if they don't, why not?
I mean, that would make me more comfortable. Like
Right.
when I go to the doctor myself, I look and see where they've been educated. Is it a college that's well known? How long have they been practicing? What's their access for referrals and specialties, or can I do that myself? So those are questions that I ask. And so I think they're probably good questions for everyone to ask of their doctor, regardless of what level they are.
Mhm. I just find it so puzzling that in basically 1/4 of a whole country, in all of Eastern Canada, there isn't a single practicing board certified veterinary neurologist. So occasionally one will visit, but you know, to have three provinces working without one, including a veterinary college, it just seems baffling.
Yeah, it's expensive to have a neurologist because of the MRI. You know, the maintenance for the cost of that machine is not cheap. And so we tend to cluster in bigger cities and with each other so that we can keep those types of costs down. Otherwise, it just costs a fortune to have somebody in a place by themselves. And if it's not super busy, it might not be very cost effective for them.
All right. Well, thank you both very much. It was a pleasure chatting with you. Hopefully things will take a turn for the better after we meet our doctor, and we'll carry on.
Well, good luck to you.
Thank you both. Bye.
You take care. Yeah, I liked how you framed sort of the answer about, you know, just advocating for yourself and for your pet and things like that. So, you know, just be asking all of those questions. It seems to be a seizure day. I'm glad that you said you like talking about seizures, because we've got a bunch more questions of people asking about seizures. Jennifer isn't coming on to Zoom. She says she has a 2-year-old Saint Bernard, seizure starting March 2020. Family keeps asking me if I have reached out to the breeder to see if it is genetic. Is this something I should be doing as a good citizen? If the breeder is having lots of puppies that have seizures, maybe I should be reporting this somewhere. Is this something that can be determined by a neurologist? I can't imagine that a breeder would be honest about this, even if it was occurring. So I guess the questions about seizures being genetic and how would we determine it, and what is the owner, the neurologist, and the breeder's role in those questions.
So seizures are thought to be genetic and known to be genetic in some breeds. I think we do a pretty poor job actually of categorizing epilepsy genetics. I think there's some European breeds that have their genetics a little bit better characterized. It's definitely worthwhile, you know, reaching out to your breeder to see if there is a family history of it, because that's one of those things that just helps us create a better working diagnosis for an idiopathic epileptic, especially in absence of an MRI. So I think it's useful to have a conversation with them about what's going on and seeing if any of the other litter mates have shared a similar condition. And most of the time, good breeders are going to be interested in talking to you about that. So the ones that I've worked with have been very honest and open. So I haven't found that to always be a huge roadblock. But again, we don't do a fantastic job of characterizing those genetics. So as far as the neurology component goes, unfortunately, there's not like a blood test that I can do that's going to be like, look, your dog has the epilepsy gene. That'd be really nice if we had that, but we don't right now.
Yep. How are you doing on time? Do you?
I think I'm okay, but I'll probably have to run pretty soon because my first appointment will be coming in pretty quick.
Okay. I think we've just got 2 more questions that look that they're in the chat here. Do you have any recommendations for dogs that experience muscle wasting due to meningitis treatment with steroids like prednisone? Exercise, acupuncture, hydrotherapy, ?
Yeah. So rehab, yes. Rehab, I'm a huge proponent of for a lot of different reasons, but absolutely it's going to be one of the best things that you can do for your pet. is getting their muscles actively engaged and learning how to use and target the neuromuscular system in smaller ways. Prednisone can be really detrimental. So trying to switch to a non-steroid immunosuppressive drug can be beneficial for a lot of those dogs. That being said, in any person or animal that has a severe nervous system disease, if the nervous system isn't functioning well, the nerves and the muscles aren't always talking to each other very well, and that in and of itself can lead to muscle wasting, even when the disease is relatively well controlled. So if you look at chronically paralyzed people, they age a lot faster, even though they might just be paralyzed from the waist down. Just their nervous system, whenever it's sick, it takes a toll on how well we function. So another, pro for rehab is keeping all of the mental faculties intact and engaged as well. But that can be a challenge for sure. But trying to get off of steroids and onto a different medication may be worthwhile, and absolutely going for alternative medicine and physical rehabilitation would be worthwhile for a lot of different reasons.
Agreed. Yeah, I mean, that would be my go-to, is just the rehab and getting off of steroids. Last question here. Mia had a little Bichon that passed away from seizures recently. He was 7 years old. Seizure started a year ago. His quality went down so rapidly in the last 3 months. Looks like the question is, what are the causes of seizures? Which you probably should have started with this question as opposed to at the end, but causes of seizures.
I like to divide it into 3 categories. I like to put idiopathic or genetic epilepsy separate because I think about it differently than the others. And then category number 2 is structural epilepsy. And that's where there's something actually wrong in the brain, whether it's a brain tumor, inflammation or encephalitis, something the pet was born with, such as hydrocephalus, so a congenital anomaly, traumatic injury, so depressed skull fracture. All of those would fall into that structural category of seizures. And then the third category will be metabolic or reactive. So that's when the brain itself is normal, but it's reacting to something abnormal in the systemic circulation. So cases of severe liver disease where they have circulating high levels of ammonia that are toxic to the brain, or exposure to different toxic substances that lead to seizures, that would all be in that metabolic category. So those are the 3 categories that I like to divide my seizures into.
Yep. I basically break it up the same way. It's just different words, but same exact thought process. So I guess, do you have a favorite surgery or favorite neurosurgery, favorite surgical tool?
I mean, brain surgeries are always fun. I think ventral slots are probably one of my favorites, which I didn't used to say. I used to think backs were more fun. But whenever you get one of those just giant pieces of disc out of a ventral slot, it's always super satisfying.
Great. And how did you end up in neurology? I guess why neurology?
It was during my internship where, you work really long hours during your internship. And even when I had really long hours and late days, if I was working with neuro cases, I was much happier doing that. And that's ultimately what had me settle on neurology. A lot of it also had to do with what I don't like doing. I didn't like dealing with vomiting and diarrhea. And so neuro was one nice way to not have to deal with that.
Great. I guess how can, if people want to follow you on social or whatnot, you want to share that or?
Yeah, so my Instagram is Pancotto. I probably am there more than Facebook, but I am on Facebook as well. Just my first name, last name, Teresa Pancotto. I think I have a Twitter handle, but I don't know that I've opened the Twitter app in probably many years. So.
Got to get back on there. And if someone's local to you and wants to schedule a consultation?
Yep, just call the hospital. So it's a veterinary specialty hospital in North County. We are part of the Ethos family.
Awesome. Well, I really enjoyed meeting you today. I really appreciate you giving your time to answer all of these questions. And
yeah, this was a lot of fun. I'm glad you invited me to do it.
Awesome. Thanks so much. Have a great day.
Thank you. You too.